The Waukesha Free Clinic understands that the pandemic has been hard, but the vaccines bring a light at the end of the tunnel. However, there's been a huge spread of misinformation that is too high, and we are doing our hardest to combat it. In this video series, we will discuss the truth of vaccines and how to spot misinformation with our volunteer vaccine advocate, Dr. Charles Durkee.
Hi, my name is Dr. Charles Durkee, and I'm a COVID vaccine ambassador for the Waukesha Free Clinic. The clinic's mission is to support the health and well-being of the vulnerable populations of Waukesha County. In keeping with this mission, the clinic is sponsoring a series of talks about COVID, the vaccines, vaccine hesitancy, and the importance of getting everyone vaccinated. Today, we will do an overview of this complex topic. I've been in practice for over 30 years. I've learned a lot during my career, and I believe that getting everyone vaccinated is our way out of this pandemic. I'm excited to be part of this mission, so let's jump in. COVID is a dangerous virus. Make no mistake about this. The pandemic has killed millions of people across the world, and it's far from over. The variants are increasing, making it ever more dangerous. It's true, if you're young and healthy, you have a much lower death rate, but it can be fatal at any age. And you can spread it to others without even knowing that you have it. People over 65, those with chronic illnesses, they're at a higher risk for having a serious illness. Latinos and African Americans also have a higher risk not only of getting COVID, but a higher risk of getting a severe, life-threatening case of COVID. 1/3 of adults who get infected may get long-term symptoms. These symptoms can occur regardless of your age, or can occur whether you felt sick or only had a mild illness. You might end up feeling chronically ill, unable to get back to your normal level of function. It's underappreciated and very scary. There are many good reasons that people would be hesitant to get a vaccination. We're naturally skeptical when something comes in that's new. Information's coming at us from many different directions, and some of it is true, some of it may not be true, or may only be rumors. We don't know who or what to believe. And fear of taking the vaccine is understandable. I often hear that there's no long-term data. It's true, it's a new vaccine, but we have plenty of data from prior vaccines that show that they have excellent safety records, and these should be no different. It was developed quickly, but all the safeguards were followed, and we'll explain more of this as we go on. So how were the vaccines made so quickly? First, there was focus. This is a real crisis. COVID is deadly, and when it started, we didn't know where it was going. You may not know this, but scientists have been working for decades on making better vaccines and making them more quickly. They were prepared for the next pandemic. They just didn't know when it would be, where it would be, or what it would be. But the processes were already in place, and now we have an excellent vaccine. Dedicated scientists worked around the clock, rarely taking days off. I've listened to some of these interviews of these unsung heroes. They're so inspiring. They knew that each day lost meant more lives lost as well. The government helped speed up the testing and the development of the vaccine, and the approval processes were very efficient. Corners were not cut. Remember, we started out with a bunch of vaccines under development, and many of them were rejected. Ultimately, only 3 were accepted for approval. The process was rigorous, and now we have these amazing vaccines. They're truly a gift. They're our way out of this pandemic. So what does the vaccine do for you? Well, it's very effective at preventing you from getting COVID, and it's amazingly effective at preventing you from getting a serious, a life-threatening case of COVID. Just think, if you got dangerously ill or worse, what would the loved ones around you who depend upon you do? And it protects also those that are around you. Your grandmother, your friend who got a chronic illness, you won't infect them. Remember, you can spread COVID even if you don't have any symptoms. Our vaccines are also more protective against the variants that are starting to spread around the United States, more protective than many of the other vaccines that have been developed elsewhere in the world. Yes, you're going to feel under the weather for a day or two after you get vaccinated. You're going to have a sore arm, but these go away. Your body is responding to getting vaccinated. What does the COVID vaccine also do for you? Because of the data now showing how effective and safe the vaccines are, the CDC has relaxed the guidelines. This is a huge change. The CDC says that we can gather outdoors and we can gather indoors without wearing a mask. Now, there are some exceptions to this, especially like riding public transportation. A business has every right to say, if you come into my place of business, I want you to wear a mask. Remember, these are data-driven decisions as we learn more about the case numbers in the United States. Go to the CDC website if you want more of the exact details. Equally important, what does the vaccine not do to you? It does not cause infertility in either women or men. This is just simply untrue. Nor does it cause birth defects. It cannot change our DNA. It tricks the body into making harmless small viral particles, and then the vaccine disappears. It's gone within a day or two. But our body learns how to respond to COVID because of this, and it does not inject a microchip into you. Think about it. This is a physical impossibility. You could not get a microchip to go through that tiny needle that is put into your arm. And it also does not inject live COVID into you. This is another myth. It cannot give you COVID. The other thing that the vaccine does not do is it does not kill you. Up to early May, over 250 million, now that's billion with a B, injections have been safely given in the United States. There have been a few allergic reactions to the Pfizer and the Moderna vaccinations, and this is well known. It was learned in the trials. At the same time, nobody has died from these allergic reactions, and almost everyone who had a reaction already had a severe case. If you have that history, tell the nurse before you get injected. Over 9 million Johnson & Johnson single-shot injections have also been given. There have been 28 cases of severe blood clots, 3 of which were fatal. This was concerning, of course, but the system worked. Millions of injections, 3 deaths, and the system caught it. And now the doctors know what to look for and how to treat it. You're much more likely to be struck by lightning or die in a car accident in the next year than you are to die from the COVID vaccine. 3 deaths from the vaccine, over 500,000 deaths from COVID. I think the numbers are very clear. We have passed the phase of uncertainty about COVID and the vaccines. COVID cases and deaths are dropping dramatically in the United States. This is not true in many other places around the world. They're not getting vaccinated and their vaccines are not as good. Experts believe that vaccinations here are a major reason for that drop. You can look at the chart and it's very clear what's going on. The vaccines, as we've noted, are very effective. Yes, a few people will get infections after they've been vaccinated, but they're mild and you're unlikely to spread them to others. And there's a powerful message that almost all of the doctors gotten vaccinated with the same vaccines that are being given to the public in general. I got mine as soon as I was eligible. The vaccines are safe even if you have other health problems such as cancer, high blood pressure, diabetes, or you're overweight. They do not make your health problems worse. But if you do have health problems like these and you get a case of COVID, it is much more likely to be a severe one. You should still get vaccinated even if you had a previous infection. This is misunderstood by many people. You are not protected for very long from getting COVID again from a regular infection. The vaccines create a much stronger response and last a lot longer. They also protect against the variants, something not true of if you've only had a prior infection. Get vaccinated. This is truly a gift. This is truly our way out of the pandemic, and the vaccines are free of charge. COVID is complex and there is a lot to cover. In future talks, we're going to learn more about the virus and the vaccines, answer frequently asked questions, and keep updated on CDC guidelines and releases. You can contact us at the Waukesha Free Clinic at any time if you have questions about COVID or the vaccine, and especially if you want help arranging for a vaccination. I'm glad you joined us. Be smart, keep your eyes open, and help us teach others about the importance of being safe and getting vaccinated. We'll see you next time.